Hi there, my name's Ian. I was a patient here in the Lewin ward back in July 2023 after suffering an ischemic stroke out of the blue.
Hello, my name's Sarah. I had a stroke back in August 22 at the age of 55.
When you arrive first on the ward, it can be quite scary to know what's going on, but this video is to highlight what is available to you as a patient, what you can ask for, and the simple things that you can go and request quite easily.
The Lewin ward is down on level 2. It's in the R block and it's right near the Jubilee Garden.
There are 6 bays with 4 beds in each bay and a bathroom.
On the ward by your bed space there would be a buzzer, so you could just press the button and somebody would come and help you if you needed help straight away.
A usual day in the Lewin ward involves being woken up at some point to take your medication and surveillance, so blood pressure, etc.
I look forward to having my wash with the help of the nurses in the bathroom. They wheel me there.
And I'd recommend bringing as much of your clothing from home and toiletries from home that you can store here, because it's nice to have a few creature comforts that remind you of home while you're here.
I had my family bring in the right footwear for me, which was helpful for me to be able to put on as well by myself.
There's also internet access here, and you can have an iPad and communicate with the outside world while you're in the hospital and communicate with your family and friends. Breakfast is usually around 8 o'clock, and you do get a full choice of what you'd like. If there are any particular requirements or you have dietary requirements, your health practitioner will speak to you about what you can and can't have. During your stay at the Lewin, you may have a timetable given to you that structures certain therapy sessions, etc. throughout your stay. These will vary day by day, so it's important to keep a note of what's going on. During my stay, I had speech and language therapy, physical therapy, and various occupational therapy and dietitians coming to speak to me on a regular basis. So do be aware that people will be coming and going all day. There's a big team on the Lewin ward, from therapists to doctors, etc., and nurses. So you'll see a lot of people coming and going all day long. They're there to help you, so please do ask for help when you need to. Don't sit there quietly. It's all about being rehabilitated and your next journey, so they're there to help you in that process. One of the nicest parts of the day is your lunch choice. You'll get a menu given to you at some point after breakfast where you can select your lunch menu option. You can bring your own food in from home by all means, but please do speak to the healthcare professionals to let them know what you're having, so they can keep a note of what you've had and just check it can be had with your medication, etc. The therapy sessions on the Lewin ward could be individual, one-to-one basis, or it could be a group participation. There was a regular gym session with several members of the ward coming down and doing a group session on rehabilitation exercise, which was really good during my stay.
Sometimes it was on the ward, but most of the time it would be a 2-to-1, and I would be helped into a wheelchair and be taken either along to the corridor so I could practice my walking, or going to the physio room again where I could practice standing up, or all the exercises with the help of all the equipment which was in the gym.
The therapist was very good because at the beginning cannot speak at all. The therapist was very good for encouraging me to speak and to have a lot of exercises by the nurse, so can speak again.
Some of your therapy, whether it's speech and language or occupational therapy, could be at the bedside, so be aware that other patients will be doing that at the same time. You may also be able to have therapy in the garden areas, whether it's outside the break room or in the Jubilee Garden.
I had some OT as well, where they helped me mostly with my arm, but also I remember going to the OT kitchen where I was challenged to bake some cookies, and they turned out amazing.
During the therapy sessions, you'll be given some additional tasks that you can do in your own time, and there's plenty of time to be able to complete these tasks. Practicing walking, talking, etc. as much as you can with around the ward area, I'd recommend doing that.
The timetable was not always full, so a lot of time will be on his own. So it's important to have something to do, because I cannot speak and I cannot walk. So a lot of things we have to have a lot of things to do during time when was no session with the therapist. Have to be able to walk again and speak again. So a lot of time was I would do be doing this on my own.
Do speak to the staff about opportunities to leave the ward during a stay. By all means, you can walk around to the garden, to the concourse, but do speak to the staff to check your ability in doing so and whether you need help in doing so as well.
Also, there's a lovely Jubilee garden where you could sit in the sunshine, and also actually there's a terrace just in the ward where if the sun shines you can spend some time outside as well, so you don't have to be stuck by your bedside.
It's very much a team environment in your room in the Lewin ward, and I'd recommend speaking to your fellow patients and a bit of camaraderie and encouragement to help them through their day as well.
If you've got any questions and you're not really sure who to ask, my husband actually did take me in my wheelchair down to the nurses station where there's always somebody there who can help you and answer your question for you.
Getting into a routine while you're on the Lewin ward is really important, so I would recommend every day getting up, having a shower and putting your own clothes on. It's really important to have a routine to help the structure of your day, and that will help your rehabilitation process in getting discharged home as well.
Hello, my name is Professor Liz Warburton and I'm one of the doctors working in the stroke unit consultant team. We have a large team of professionals on the Lewin who are all there to support you and your recovery as much as they can. The time on the Lewin ward is only really the start of your overall journey. The Lewin ward is a space that's specifically designed for both assessment and rehabilitation. So if you are admitted to the Lewin ward, you could either be a neuro rehabilitation patient or somebody who's had a stroke who then is pretty much medically stable and needs either assessment or rehabilitation. What happens to you may depend on where you live. So the ward really is for patients from Cambridgeshire. So if you don't live in Cambridgeshire, then you may be on the Lewin for a short time, waiting for an appropriate place for you to go in your own area. You may need a short period where we assess problems, issues, and what treatment you need, and then you may be on the ward for only a few days before you're allowed to go home and carry on with whatever rehabilitation you need at home.